Take a moment to think about it. When you walk through the door of a doctor's office, what's the first thing they see? Not your lab results, not your medical chart, but you. Your walk, your posture, your expression, the clothes you chose this morning, even the way you hold your hands or lower your gaze. All of this happens before the first hello is even spoken. And this isn't about fashion or vanity. This is about things that directly influence how you're treated, how carefully you're listened to, what tests are ordered, and whether you get timely help if it's something serious. It might seem like these small details don't matter, but in medicine, the first few minutes of contact between a patient and a doctor are critical. A couple of wrong signals, and an image begins to form in the doctor's subconscious that can influence every decision that follows. And it's not because medical professionals are intentionally biased, it's just that the human brain is wired to respond to visual and behavioral cues. Recent studies paint a concerning picture. Women over 60 are nearly 40% more likely to have their complaints and symptoms perceived as less serious than those of younger patients. This isn't because older women complain more or less clearly, but because in those first moments, they might be sending the wrong signals that can subconsciously set a doctor's attitude. I've seen it happen countless times over my years in practice. Sometimes a person's appearance or behavior in those first few minutes can change the entire course of their treatment. To help you avoid this, I want to share 6 common mistakes that could cost you your health. The first is what I call the invisible patient syndrome. Eleanor, 73, was a vibrant, sharp-as-a-tack retired teacher. We'd known each other for years. At her appointments, she was always put together, with a gentle smile, quick to start a conversation, crack a joke, and ask plenty of questions. But one day when she came in complaining of chest pain, I barely recognized her. She entered slowly, shuffling her feet, wearing stretched-out sweatpants and an old faded hoodie that was several sizes too big. Her hair was pulled back in a messy bun, her eyes were downcast and her hands were hidden in her pockets. It was as if she was trying to become invisible. I knew Eleanor and understood she hadn't become a different person overnight, but any other doctor or nurse who saw her in that moment would have found it hard not to get the impression that this was someone who had given up, who was no longer in the fight. And that, as research from Harvard Medical School shows, is critically important. Medical staff spend, on average, 23% less time on patients who appear unkempt or indifferent about themselves. In Eleanor's case, it turned out to be very serious. She had a significant arterial blockage that required immediate intervention. We caught it in time, but I often wonder, what if she had gone to a busy clinic that day, where the doctor was rushed and the stream of patients didn't allow for individual attention? Would her complaints have been taken as seriously? This isn't a question of fashion or expensive labels. It's about your appearance being your first nonverbal signal. I am here, I value my health, I am ready to talk and listen. It affects not only how the doctor perceives you, but also how you conduct the conversation yourself. When you arrive looking neat, well-groomed, with straight posture and a confident gaze, you unknowingly say something entirely different about yourself than if you were to show up in wrinkled clothes with slumped shoulders. I always advise preparing for an appointment so that your appearance helps you, not hinders you. You don't need a power suit or elaborate makeup. Clean, neat, comfortable clothing that's easy to move in, and a tidy hairstyle are enough. Before leaving the house, it's worth asking yourself, if I were the doctor, would I take this person seriously? It's a simple but incredibly useful test. And now let's talk about the next mistake, which seems harmless at first but can rob you of a thorough examination and cost you precious time. I often see patients arrive for appointments in clothing that gets in the way of their own examination. On the surface, it seems thoughtful or even respectful. I'm going to the doctor. I should dress warmly and properly. But in practice, this concern for one's image turns into a problem. Brenda, 68, came for a routine checkup in late February. It was cold and she decided to bundle up. She was wearing thick tights, a long skirt, a heavy wool sweater over a turtleneck, and a bulky winter coat on top. Add to that a wide belt and a restrictive support bra. It all looked neat, even stylish. But when I asked her to lie down on the exam table so I could listen to her heart and lungs, we hit an unexpected roadblock. Every single layer had to be unbuttoned, unzipped, or removed entirely. 8 minutes. That's exactly how much time out of a 15-minute appointment was spent just getting to her chest and abdomen. Meanwhile, the next patients were already waiting in the hallway. And this is where the real danger lies. A doctor may simply not have enough time to perform all the necessary checks. Sometimes parts of the exam are shortened or skipped altogether, especially if the patient's complaints don't seem too serious at first glance. I remember a case where an elderly woman was sent home with a diagnosis of fatigue and a recommendation to get more rest because a full physical exam was never completed. A week later, she was rushed to the hospital with a heart attack. This isn't the fault of one specific doctor. It's just that appointment times are limited, and if half of it is spent on undressing, the diagnostic part gets cut short. A study published in a journal of primary care found that patients whose clothing hindered an examination were 31% more likely to need follow-up visits due to an incomplete diagnosis. That means extra stress, extra money, lost time, and sometimes a missed opportunity to stop a disease in its tracks. So when you have an appointment, dress for ease of examination. A light blouse or a button-down shirt, pants that can be easily rolled up, a comfortable cardigan instead of a tight pullover. All of these help the doctor work more quickly and thoroughly. Avoid complicated fasteners, shapewear, and multiple layers on appointment days. Your goal is to save every minute for conversation and examination, not to waste it on wrangling with your clothes. Sometimes it's not the clothes themselves, but what we add to them. This brings me to Lillian, age 70. She was always an elegant woman, and for her cardiology appointment, she decided her appearance was a sign of respect for the doctor. She wore a chunky cocktail ring, a bracelet, long dangling earrings, a double-strand pearl necklace, and a decorative belt. It seemed to give her charm and confidence. But when it was time for her EKG, the jewelry became a real obstacle. We couldn't place the electrodes properly because of her necklace. The bracelets interfered with the blood pressure cuff. The belt made it hard to access her abdomen. Precious minutes were wasted carefully removing and setting aside her accessories. And I vividly remember another case where a similar situation nearly cost a patient her life. Last year, Valerie, 81, walked into my office complaining of a sharp, sudden chest pain. We needed to hook her up to the monitor immediately, but she was wearing several tangled necklaces that we couldn't get off quickly. When every second counts, little things like that become dangerous. Few people realize that metal can interfere with medical equipment, creating noise on an EKG or distorting X-ray images. Tight shapewear can hide symptoms, like lumps in the abdomen or breast area, and can also make it difficult to assess breathing. Even a simple belt can sometimes make a quick examination impossible. My advice is simple. On the day of your appointment, wear minimal jewelry and only pieces that are easy to remove. Skip the complicated belts, shapewear, and layers of chains. Your beauty and elegance won't disappear if you wear a neat cardigan and simple earrings, but you will definitely save time and stress, and in an emergency, it could save your life. I often notice another signal that we doctors pick up on instantly, one that can be more alarming than any words. I'm talking about hygiene. Sometimes a person enters the office and there's a noticeable body odor. Their clothes are wrinkled or stained, their hair hasn't been washed in a while. And believe me, this isn't about judgment. We notice these things because a sudden decline in hygiene in a previously neat person can be a sign of serious problems, from depression and chronic pain to the first signs of dementia. I've seen women who always took pride in their appearance suddenly stop paying attention to it. When I would gently inquire, I'd find out that for one, back pain made showering and doing her hair an ordeal. For another, memory problems were starting to take hold. And for someone else, they simply couldn't manage daily tasks without help anymore. A doctor from Stanford, Sarah Chen, published a study showing that a decline in personal hygiene can precede a dementia diagnosis by up to 2 years. For a physician, this is a crucial diagnostic clue. Conversely, when a patient arrives clean and neat, even in simple clothes, it immediately shows that they are managing their daily life and are likely in a stable emotional state. Do you see how much the details you might not even think about can reveal? And all of this happens before you even start talking about your symptoms. When someone walks into my office, I can't help but look at their shoes. And it's not because I'm judging their style. The truth is, shoes tell a doctor a lot more than you might think. From the way a person walks, plants their foot, and maintains balance, we can learn about the condition of their joints, muscles, bones, and most importantly, their fall risk. 1 in 4 people over the age of 65 falls at least once a year. These falls are the leading cause of injuries that require hospitalization in older adults, and to a large extent, inappropriate footwear is to blame. Nancy, 74, came to an appointment wearing soft ballet flats. They were comfortable, but the elastic holding the heel had long since stretched out. As she stood up from her chair, the toe of one shoe caught on the rug, and she stumbled. I managed to catch her, but that moment could have easily ended in a broken hip. I've also seen worn-out sneakers with collapsed soles, sandals that slip off with every step, and flimsy flats that become slick on the slightest bit of moisture. All of this is not just uncomfortable, it sends a signal to the doctor. This person isn't paying attention to their safety. For me, that means I absolutely need to discuss bone density, muscle strength, coordination, and home safety precautions with them. Your shoes should have a sturdy sole, good arch support, and a fixed heel or strap. And this isn't about looking young. It's about making every step you take confident and safe. Even a simple but supportive pair of sneakers can prevent a life-altering fall. But sometimes patients make an even stranger choice. They come in their house clothes. I'm not talking about cases where someone is seriously ill or has just been discharged from the hospital, but about routine visits and preventive checkups where people show up in pajama pants, robes, or nightgowns. This not only creates a certain impression, but also affects the person wearing them. Studies in cognitive psychology show that our clothes influence how we think and act. Pajamas or overly casual loungewear are like telling your brain to shift into low gear. In that state, you're less likely to ask questions, less inclined to challenge something, and less likely to advocate for yourself. I remember Carol, 69. Her family was worried about her memory lapses, so we brought her in for a cognitive assessment. She arrived in pajama pants and soft slippers, her gaze averted, speaking in a quiet voice. The first impression was concerning, but 2 weeks later, when we repeated the test, Carol showed up in elegant slacks and a bright blazer, with her hair neatly styled. She looked me straight in the eye, answered more confidently, and her test results were better. Clothing isn't just fabric, it's a mindset. By coming to your appointment in neat, everyday clothes, you demonstrate that you are ready to be an active participant in the conversation about your health. This doesn't mean you need to get dressed up, but it's important not to come in your pajamas unless your health absolutely requires it. There's one more detail many people overlook: the color of their clothes. I call this the fading into the wallpaper effect. All too often, older women choose black, gray, or drab brown. These colors feel safe and familiar, but they literally make you invisible. Helen, 82, had been complaining of chest pains for months. She had seen different specialists, always wearing dark glasses, a gray sweater, and black pants. Her complaints were noted, but she was never sent for a more in-depth workup. Then one day she came to my office wearing a turquoise blouse and a coral scarf. The difference was striking. The staff smiled at her, nurses leaned in to listen more closely, and her words were perceived completely differently. We did the workup. It turned out Helen had serious ischemic heart disease. Color also affects how we see ourselves. Warm, rich shades like sapphire, emerald, deep red, or plum can lift your mood, give you confidence, and make others respond more warmly to you. This doesn't mean you need to dress like a traffic light. Simply adding a bright scarf, blouse, or even a swipe of a cheerful lipstick is enough. All of this, shoes, clothes, color, may seem like external details, but they are the very first signals that determine how much time you'll be given, how carefully you'll be listened to, and how seriously your complaints will be taken. Next, we'll put it all together and create a step-by-step plan to help you turn every doctor's visit into a productive meeting where you receive the maximum attention and care. We've already discussed how small external details can impact how attentively you're heard and how thoroughly you're examined. But it's not enough just to know these things. You need to turn them into a habit. For that, you need a plan, simple but clear, so that before every doctor's visit, you can prepare without a second thought to maximize your chances of receiving high-quality medical care. Start the evening before. Choose comfortable clothes that are easy to take off or unbutton. preferably with front closures. Think about color. Let it be something that gives you energy and confidence. A bright but pleasant shade. Prepare comfortable shoes with a stable sole and heel support. Keep jewelry to a minimum and choose pieces that are quick and easy to remove. On the morning of your visit, take care of basic hygiene. Take a shower, wash and brush your hair, brush your teeth. Even if you're only going for a few minutes, these actions not only make the right impression, but also help you feel more put together and confident. Before you leave, look in the mirror and tell yourself, I deserve to be taken seriously. I am here to take care of my health. When you get to the clinic, hold your posture straight, look the doctor in the eye, and speak clearly. If you don't understand something, ask for clarification. If something is bothering you, say it directly. Remember, your job is to convey all the important information to the doctor, and their job is to help you. The more confident and clear your presentation, the easier it will be to build a dialogue. Avoid things that interfere with the exam or send the wrong signal. Don't wear complicated, multi-layered outfits. Don't use shapewear that's difficult to remove. And don't choose shoes you could trip in. Don't show up in pajamas or clothes associated with fatigue and indifference. Don't hide behind gray, faded colors. Let there be at least one element in your outfit that says, I am here, I am living, and I want to be heard. Remember, this isn't about fashion or trying to impress someone. This is a tool. When you value yourself and show it in the details, people, including doctors, will subconsciously treat you with greater attention. It's not a guarantee that a diagnosis will be made instantly, but it is a real way to increase your chances of being heard, having important details noticed, and getting timely intervention. I've seen how a simple change in how a person prepares for an appointment can alter not only the quality of their medical care, but also their sense of well-being in daily life. Women began to advocate for themselves more confidently, ask for necessary tests, and ask more questions. They left the office feeling they had done everything possible for their health, and that, perhaps, is the most important thing. Because taking care of yourself doesn't start with pills and procedures, but with an internal decision. I am worthy of help. And then every detail, from the blouse you choose to your straight posture, becomes a part of your defense and your strength. So the next time you're getting ready to see the doctor, don't put off these simple steps. Prepare yourself so that from the very first minute of your visit, they think, this is someone I need to listen to carefully and take seriously. Share this information with a friend, a neighbor, or a sister. It might be a revelation for them that could one day save their health or even their life. And if this topic resonates with you and you'd like to receive more practical, honest, and useful advice like this, please take a moment to subscribe to this channel and turn on notifications. Let's work together to build a culture of respect for ourselves and our health, one step at a time, starting with what we can do today.